as Aaron explained, there's a lot of projects all to do all at the same time, all different schedules and timelines. So sequencing, phasing is super critical. So we issued the RFP with a minimum criteria of 5 years with healthcare background in construction management, requiring a WBE Utilization Plan. The substantive criteria is 25% approach and methodology, 25% of staff experience, 20% of firm experience, and 15% cost, 15% MWBE. And right there you have a list of the voting members for the evaluation committee, 3 of which were from Elmhurst, 1 from EITS, and another member from OFD, I thought. So I think that's the
I would
typo
be the
there.
OFD
But
slash
yeah,
Elmhurst,
there's a typo there. There was the member from OFD as well. Next slide. So this is a quick overview of the procurement timeline. We published on City Record. Also in parallel, we sent the RFP directly to 51 vendors. We had a pre-proposal conference, 17 vendors attended. Out of those, 10 proposals were received. We shortlisted 5 firms, which we brought back for presentations, and that yielded Guth Kunzo to be the highest rated proposer. Next slide. So Guth Kunzo, highest rated proposer. The contract award amount is for $9,197,500. We are requesting for an additional contingency of 20% to total of $1,839,500 to be added to the contract. So that would be a total not to exceed amount of 20% contract with 20% contingency of $11,027,000. Guth Kunzo has historically performed very well. They have done specifically CM, or excuse me, construction management work at Elmhurst, specifically for the NYPA energy projects in the past, specifically to the hot water heaters and air handling units. In addition, we did a little bit of more research, and they have had excellent ratings both at the OGS and SUNY projects, also, again, for CM managed type work. Next slide. So this is another quick recap of what I just mentioned. They performed work at Elmhurst, specifically for CM Managed. They have also performed work as a CM Build under the NYPA energy contract. Those are the list of the work that they've had and they've completed, or targeting to complete in the near future. Next slide. So additional contingency. This particular portfolio is very complex. We got to keep the lights on and doors open to continue to provide services, as well as coordinate all of these very complex projects. So design coordination is critical. Intricacies in assembling the multiple contracts. Again, nuances in coordination of the various construction projects at the locations, at Elmhurst. Scheduling, durations, and minimizing the inpatient impact for the progression of aggregate capital portfolio. And then last but definitely not least, the phasing of the construction in an active hospital with a landlocked footprint. Next slide. This is the utilization plan. 12 MWE firms were invited to the procurement, but Guth Kunzo came out ahead with 2 sub-consultants, both MWBEs at 15% each, respectively. Next slide. And this is the official request. Do you want me to read the request, or we're good? Okay, so we'll take any questions.
Great, thank you very much for the presentation. I'll go around for questions. Dr. Katz?
No questions.
Fenioski Peñamora?
No questions.
Sally Hernandez Pinheiro?
I have 2 questions. One relates to the executive summary and the terms of the executive summary. It says no work will be committed to DeConzo by the execution of the proposed contract, but rather Jacobs will be available to accept work orders. So What is, who's Jacobs? I've lost track of you.
That's a typo. Doug Jacobs is for NCB.
Yeah, that's a different facility. That's a different resolution. This is specifically just for Gutacunzo.
Oh, okay, at least I was paying attention.
Yeah. You're right. You're right.
Good catch, Sally.
Okay, and the second question is, this is like such an intricate contract, and as I think Manny just read through, the coordination, the scheduling,
Yeah.
all of this, 20 projects, $140 million. And I understand they've done some work for Elmhurst in the past,
Mhm.
but you have confidence that they'll be able to handle all of these moving parts at the same time.
Yes, definitely. That is why we're bringing them on board. They have performed very well in the past as a CM manager, coordinating all of this. It is a lot. They need to bring on an entire team to do this, and they've done that in the past for us, and they've come out ahead. So we're confident that they're going to do well here as well.
Okay, thank you.
Thank you, Sally. I just have one question more for understanding. So the CM contract pricing is that based on the project costs? And so I'm just wondering on the contingency, how does that expand? Is it that the scope of the cost of the project expands and so their would expand, or is it an hourly kind of, how does the pricing work?
So it is hourly, but the way that the consultants put their proposal together is around a team, and that team is based around the core project here, which is the Elmhurst Hospital. All of the other projects are extra projects, but they all have different timelines. So there may be additional project managers that come on board, or some will phase out. But the most critical thing to understand here is that we're so early doors, and there's so many complexities that there may be changes in scope. There may be additional time. There may be additional teams that we need to add on that we're just not considering right now. So we know we have some known unknowns, but there may be some unknowns as well. And that's why we want to give ourselves a little bit of flexibility, either for additional staff or additional time.
Right, but the original proposal would be based on what you understand for the 20 projects right now.
That's right, based on what we know today. Correct.
Right. Okay. And then, as you said, there are many known unknowns and unknown unknowns that could change that.
Yeah, that's right.
Okay. Thank you. If there are no other questions, I'll go ahead and poll for a vote, starting with Dr. Katz,
Yes.
Tenioski Peñamora,
Yes.
Sally Hernandez Pinheiro,
Yes.
and I also vote yes. Thank you very much to the team. And I think before we move to the next resolution, Chair Peñamora, are you?
Yes. Thank you, Frida. I will recuse from the remaining of the meeting. Okay. Thank you.
Thank you, Penny.
Bye-bye.
Aye. We have one more item for consideration. That's the resolution with project management. I'm not sure who's going to read the resolution, but is it, Manny, are you going to read it?
Yes, I'll read it. Thank you. The final resolution is authorizing New York City Health and Hospitals Corporation to execute a contract with Jacobs Project Management Corp. To provide planning, construction management, and project management services on an as-needed basis with respect to several pending projects at New York City Health and Hospitals Jacoby Center, New York North Central Bronx campus, for a term of 3 years, the system holding 2 one-year options to renew with a 25% contingency of $2,816,186 for an amount not to exceed $14,080,929.
Thank you, Manny. So yes, this is the request to enter into contract with Jacobs, a construction manager, CM, at NCB to perform work or to help manage the entire portfolio at NCB. With me today is Jimmy John, our capital lead at NCB, and he will go over the little bit of the background and the portfolio, and then I'll take it back.
Thank you, Oscar. NCB Hospital has a number of existing uninitiated and active capital projects with significant public interest in investing in the hospital. Some of the major infrastructure components at NCB are nearing the end of useful life. Some capital projects have direct adjacencies that will require complex coordination and staging. These projects cannot be coordinated without the support of the existing operational team. To ensure these additional opportunities to secure funding, all the funds needs to demonstrate progress. That's why we are in the process of securing a master planning contract for NCB. The CM vendor will be responsible for coordinating the execution of key milestone project schedules and will help enable long-term strategic decision making. Next slide, please. So here's a list of projects that are going to happen at NCB. OTHU being the big ticket. We use this opportunity to combine a lot of capital projects as part of this this pool of projects. So I'll go over the projects. OTHU currently is in schematic design phase. It's a $240 million project. Fire alarm, fire sprinkler upgrade for the whole building. We're at schematic design, $25 million project. We are upgrading the ORs at NCB, which is at planning phase, $3.5 million project. Energy upgrade, which is replacing air handlers, replacing lights, upgrading the elevators in the building for a total of $38 million. Type 1 electrical emergency services, which is upgrading the electrical services at the building for $18 million. Local Law 11 facade rehab project, where we're replacing all the windows on the exterior facade of the building and repointing the building for a total of $16 million. We're replacing, last but not the least, we have a boiler replacement project for about $17 million project. The total portfolio for this CM builder would be about $357.5 million. Firewatch will be in place during the duration of the project, which would impact any fire life safety systems. And close coordination with facility and the clinical team will ensure the project will have minimum impact on delivery of services. When possible, scheduling project work for times outside of normal business hours for clinical areas. We're anticipating using second shift for this work, and phasing of work to reduce impact to facilities' capacity to provide care on inpatient units and the ORs.
Thank you, Jimmy. So as you can see, a lot going on at NCB, a lot of moving parts, but very similar to Elmhurst. You got the core project, OTXHU, which we're also implementing at the other facilities. So we've taken the lessons learned from over there and brought it here and are trying to implement as best as we can. So we issued the RFP with a minimum criteria of 5 years of healthcare construction management experience with a required WBE Utilization Plan. Substantive criteria is one of those words I can't say. 25% approach and methodologies, 25% staff experience, 20% of firm experience, 15% cost, 15% MWBE. And there's the list of the evaluation committee members, 2 from MCB, 2 from OFD, 1 EITS, and some advising members as well. Right there is a quick overview of the procurement timeline. We published on City Record, as well as invited 51 vendors directly. At our pre-proposal conference, 16 vendors attended. From there, we received 11 proposals. We shortlisted 4 firms, which we brought back for presentations, and that yielded Jacobs to be the highest rated proposer. So next slide. So this is the breakdown. Contract award amount is $11,264,744. Contingency, we're asking for a little bit more, 25%. a little bit more than usual, totaling of 2,816,186 to be added to the contract. That's a not to exceed value contract of 25% contingency of 14,080,929. Jacobs has performed very well in our past. They are currently doing the express care, which I think that job is wrapping up. They're doing some water infiltration work at East New York. The Harlem Boiler Project, which is hopefully our design build project. Indoor air quality under the CARES program. They were able to do the work there in Brooklyn and Queens, and they also helped us during COVID at NCB and at COLA to increase med surge capacity. So they have always been very responsive, they've been very good, and they've been able to coordinate the work very, very, very well. Next slide. So additional reasons for the contingency. Essentially the same thing, just to kind of talk through this real quick. A lot of coordination, a lot of assembling, a lot of phasing, a lot of sequencing. The NCB is going to get impacted a lot, even though it's only 4 floors that we're actually decanting, and but really about 80% of the hospital is going to get impacted. So same thing, we have to keep the doors open and the lights on and continue to provide service as we're implementing all of these programs. So Jacobs will help us with the logistics and the phasing plan. And right there is the breakdown for the WBE. Out of the firms that were invited, 12 were MWBE, but ultimately Jacobs came ahead with the list of 5 sub-consultants that make up a total of 33.9% for a utilization plan. Next slide, and that is the resolution, and we will take any questions.
Thank you, Oscar. Dr. Katz, any questions? Dr. Katz said no. Sally? Oh.
Sorry, no, yes.
Great,
No,
you.
yes.
Sally?
I have a couple of questions. The projects other than I always forget the name of it, OXTU.
Yeah,
whatever,
the
project.
outposted therapeutic housing units.
Yes. Those the 140 million or so of those projects, how many of them are like what you're doing with the big project kind of affects a part of the capital infrastructure, and so you may as well go ahead and do it? And how many of them are kind of critical needs that have to be handled simultaneously as well, along with handling the occupational therapeutic health project?
So, Sally, if I think I understand you correctly, you're trying to better understand the interdependencies between the 2 projects, between the multiple projects that are there?
Well, the interdependency and the hierarchy of needs, which are, we needed to have a boiler replaced. There was no question about it. The boiler was going down. Or are you saying, since we're doing this huge project, we may as well ramp up the boiler?
Yeah.
I'm trying to understand the hierarchy of needs.
So let me try to take a stab at it before my team responds. So I'll give you one example: the fire alarm. The fire alarm is very critical to do. Even if we were to build out the spaces on those 4 floors, if the backbone of the fire alarm for the rest of the building is not done, then we can't get the OTXHU portion signed off. So that's more of a, like, it has to happen in order for us to be able to get this signed off. The energy projects, those I would say, since we're here, let's try and wrap these up at the same time. Some of the air handling units may be depending in those particular spaces, but other air handling units will cover other areas that won't necessarily have to be completed for OTXHU to be completed.
Correct.
Do you guys want to add anything else to
Yes.
that?
So any infrastructure project would be a direct correlation to the OTHU, like fire alarm, as you mentioned, fire alarm, sprinkler, type 1 EES.
Yeah.
While we are there, might as well
Might
get
as-
this done.
Right, the ORs as well.
The
That's
ORs
another
as
one
well.
that's
Correct.
more of optional since we're there.
Mm-hmm.
And then
Local law 11.
local law 11, it might be a bit of a mix, right?
It's a mix because we're changing
Correct.
all the glasses,
Right.
the windows in the building.
Yeah.
So we need to think about how we get all these pieces up and
Correct.
down.
Otherwise, Sally, if we just wait till we finish OTXHU, then we're going to continue impacting the facility years to come after that. Since we're here, might
Right.
as well let's do all this work, let's coordinate all this work, and it seems to make more sense than not.
Yeah, I understand. And in terms of this master planner that is being hired in addition, how does that, where's the kind of the interface, and how does that work with this construction management? Are there more capital projects in the offing?
Oh, okay. I think you're referring to the master planning RFP that we're doing separately.
Yes.
So the master
I'm
plan.
glad you're here to translate.
Yeah. No, totally understood.
Okay.
So the master planning, yes, ideally we'd want to bring somebody in beforehand to give us a master plan and really study the facility and to try and dictate and drive what we can do, what options are available to us over the next 5, 10, 20 years, whatever the case is. We have a little bit of a different story. We don't necessarily have a master plan, but we have worked closely with the consultants, with the facility team to develop a plan for the facility. So we unofficially have a master plan because we have to do all of this work, and it became so critical because of deferred maintenance, and we just didn't do a lot of things that needed to get done. Now we're here. Now we have a big infusion of monies. We have a big program coming in. So organically, we've developed a master plan for the facility, and
Yes.
and essentially the CM is going to help drive that for us.
I also get a sense that part of this envisions kind of some changes to the uh, operations and kind of role of NCB. I think some of this may be positioning it for enhanced roles. Maybe that's just my own projection, but it kind of feels like that.
Okay.
Yeah.
Understood.
Okay, thank you.
No problem.
Thank you, Sally. Oscar, who is managing the OTXHU? Who are the construction managers at the other sites? It's not, Jacobs isn't doing that.
No. So OTXHU, we have a program manager, AECOM, and for Bellevue, we have what's called so at Bellevue we have a CM builder, not a CM manager. So
I see.
the CM themselves are holding the construction contracts, so they're essentially managing their work and they're executing their work as well. For Woodhall, we are active. We're trying to go into procurement, and we're hoping to release that soon. I believe we came to CRC already to request for that solicitation authorization. Yeah.
Okay.
Oh, I'm sorry.
And so-
And Frida, there's one more consultant. We have Hunter Roberts, who's helping us add Woodhall to decant some of the work over there. So Woodhall got separated out into two sections because they had the decanting portion. Here we have the decanting portion as well at NCB, but we're trying to wrap it all into one vendor.
And AECOM as program managers for all of the sites, or just?
No, AECOM is only for Bellevue and Woodhall.
Bellevue and Woodhall. Okay, so here it's kind of Jacobs will be the main core.
That's correct. Yes. Initially, when the program got rolled out, we only had the 2 locations, and we only received NCB. I want to say last year. I think in 2021, I believe we received the funding for NCB.
Mm-hmm. And we had have those construction contracts been bid out already? The OTXHU here at NCB?
No,
Because
no,
I thought
we're still
no.
we're still
Okay.
in design.
Still in design.
We're still in design. We're trying to bring the CM on board quickly. We have bid out some of the construction work already, but it would be really helpful if we can bring the CM on board now during design, so that we can work closely with the architects and the engineers to coordinate all of this work and see who's on first, who's on second, who done, and how we do that most effectively, most efficiently.
Right. Okay. And they're still working on some other projects for us at other facilities, right, Jacobs? And
Yes, they're doing.
'cause
They're,
there's a lot. This is very complicated.
Yes, it is very complicated. We ensured that the teams are going to be separate, so they're not mixing up the teams. I think their second biggest project with us is going to be the Harlem Boilers, which again, that one we're trying to wrap up the bridging documents for design build, and then before that, they are wrapping up the express care, so that's essentially closed out, and the water infiltration project at East New York, which is not that large.
Right.
They,
So we're not concerned about capacity. They have different teams.
They have different teams. At East New York, they have
Mhm.
one person, David Fox. At Express Care, they got Craig Miller. And I forget the team for Harlem, John DeMays. Actually, no, not John DeMays. John DeMays is for here. Yeah, a completely different team. I'm trying to remember the names, but
That's
yeah, we verified that as different teams.
Okay, terrific. Thank you. The other question was just and again, more out of curiosity. I understand the complexity and all the unknowns, et cetera, so the need for the large contingency, but I noted the last one, 20% here, 25, just curious as to how you come up with that.
So it's. I mean, I'm gonna let my team speak here for a minute, but it is a much larger program, and it has I feel slightly higher levels of complexity, especially with OTXHU. I mentioned lessons learned. With the SCOC standards and regulatory. We had some complications for the Bellevue project. We expect similar complications here. Now there's this change in leadership over there as well. So maybe what we've already started designing, maybe we're gonna have to shift gears and redesign some stuff. Also, unlike Elmhurst, here we're also injecting a different component. We have the energy projects, we have DCAS regulatory, we have climate resiliency, we just signed a pledge with HHS. So there's a lot more here at NCB that's happening, not only by bigger sticker price, but also on the regulatory side. Is there
Okay,
anything
and
you
the
guys want to
scope,
add to that?
No.
I wondered if it was the OTXHU. That's a lot of uncertainty as well. So
I would doubt that's definitely it's a little bit more delicate.
right, understood. As we've seen. So I think this might just be a typo in the executive summary. It says the contract is for 5 years with 2 one-year options on the executive summary. I want to confirm we are talking about 3-year with 2 1-year. Is that right?
It should be 3 and 2 plus 3 plus 2 1-year options.
Okay, so maybe just for the full board, we
Okay,
that
we'll make that change. Thank you, Frida.
Great. Okay, if no more questions, I'll call for a vote. Dr. Katz?
Yes.
Sally?
Yes.
I vote yes, and so I think the resolution has carried, and thank you guys very much for the presentation.
Awesome. Thank you.
Thank you.
And is there any old business, any new business? There being no further discussion, the meeting is adjourned. Thank you.
Thank you, Frida.
Thank you.
Thank you.
Good
Take care.
job.
Thanks, bye.
This meeting is no longer being recorded.
The projection was the right one, right? So the print is the right one.
This here.